Welcome again. We want to talk about, can I take amoxicillin while I'm pregnant? It's a form of antibiotics, and the scientist says that it is safe to take amoxicillin during all stages of pregnancy. But one thing, just ensure to take it exactly as directed by your doctor. And to ensure it fully treats the underlying condition, take it as it is prescribed. So when you are pregnant, you share a lot of things with your baby, with your growing baby, your food, your oxygen, your water, even the drugs, everything that you take, even the nourishment pass from you through the placenta to this unborn baby. You understand? So hence the need for you to be careful on whatever you are taking inside, because it might have effect on that baby. You understand? That placenta, as an organ in your uterus, it has as the baby lifeline. That's the baby's lifeline. So medication, as water, food, oxygen, and everything is passing, your medications too that you've taken as a mother can also go to the baby. So hence, most dog must be safe for you. Of course, must be safe for the baby. But there are chances that some of the drugs that we take might harm or may harm the developing baby. But the funniest part, it is still uncommon to need medication during pregnancy. If you are eating right, apart from the first trimester, you have a lot of morning sickness and all that, your body is trying to get adjusted. But if perhaps you now get a bacterial infection while you are pregnant, you may need to take an antibiotics. You understand? According to your healthcare provider. And amoxicillin is one of them. And amoxicillin is used to treat some infection, which might be during pregnancy or not during pregnancy. But it's a prescription drug. It's a prescription drug. It's not a drug that you just go to the pharmacy and say, I need amoxicillin. It's an antibiotic that has to be prescribed by your doctor, because it is used to treat various bacterial infections like pneumonia. You understand? Is a chest infection like bronchitis. It's also a chest infection, which is very common most of the time in pregnancy. They use it to treat urinary tract infection. Of course, it's common in pregnancy. It can also be used to treat skin, throat, and ear infection. Your throat, your skin, all those, because you have lowered immunity because you are pregnant. And what does it do? This drug works by stopping the growth of harmful bacteria in your body. You understand? That bactericidal. We have bactericidal, we have bacteriostatic. It will stop the growth. You understand? It will kill it will stop the growth of harmful bacteria in your body, which in turn clears the infection. But I want to tell you, before you take any drug, even some drinks, especially the natural drink, so to say, you must talk to your doctor. So what do you need to know about the safety of amoxicillin during pregnancy? We're going to be visiting that shortly. Number one, you will have to find out the possible side effects this drug may cause. You understand? As well as how an infection can affect your pregnancy. And as, of course, how an infection can affect pregnancy if the drug is not taken. How the drug can affect your pregnancy if it's taken. So amoxicillin is safe to take generally overall, according to doctors, during pregnancy. Amoxicillin is the group of, I think it is group of penicillin or something. They are a group of penicillin family of antibiotics. Penicillin, we have various classes of injections or drugs. We have them viral drugs. We have the fungi drugs and all that. And some of them are safe to take during pregnancy, while some are not. Is a no-go area. You understand? But overall, amoxicillin is considered category B, the drug by the U.S. Food and Drug Administration. That means it's considered safe to take while pregnancy. Then the Food and Drug Administration has signed this category to help doctors understand whether or not amoxicillin can cause back defect when taken by pregnant women. In animal study, there were no report of any harm or deformity or developing or harm to developing babies from the use of amoxicillin. So the drug is relatively safe, but before you take any drug, it's considered low risk if a woman takes it in any of the trimester. And we have 3 trimesters. The first trimester, the first 3 months of pregnancy. The second trimester, the second trimester. The second 3 months, and the third trimester is the third 3 months. So it is considered safe. But there are also various antibiotics that are considered safe. So before you take any drug, please check to your doctor. Some of these drugs that are safe include clindamycin, erythromycin. They are also including other drugs as the same group, such as like ampicillin, I think, penicillin. Whatever the issue, let doctor examine you, tell them, they'll be able to decide for you which antibiotics is best and safest for you to take during your pregnancy. See you in the next